You are watching the Doc Talk Show.
This message is from the Ministry of Health with support from partners.
Good evening to our dear viewers. Thank you for keeping it at Doc Talk Show. This is yet another edition of Doc Talk Show where we talk about health challenges that people are facing in the community and how best we can prevent them. My name is Dr. Alex Lwesabula Luchams and I'm going to be your host tonight. This show airs out every Thursday at 9 p.m. So keep it at Doc Talk Show every Thursday so that you get health workers talking about the different health conditions and how best you can prevent them. This show is proudly sponsored by Ministry of Health of Uganda and Kamaline Men's Collections, which provides suits. Check out on them. If you have any function, graduation parties, and all kinds of parties, check out on them, and so that we always bring you these sessions. Today, our topic is going to be diabetes mellitus. This is a condition that was formerly known to be the disease of the rich, but we're seeing that now it's affecting people of low and middle income status. So I have our very own medical doctors that we're going to be delving into this topic with. Allow me to give a chance to our panelists to briefly introduce themselves so that and then we go deep into the discussion. Dr. Henry.
Thank you very much, Dr. Alex, for that introduction. Good evening, our beloved viewers. Thank you very much for being part of this show. Like rightly introduced, my name is Dr. Sechanzi Henry. I'm super happy to be here to talk about this topic that I'm very passionate about.
Thank you so much. Dr. Kamara.
Thank you. My name is Dr. Kamara Ivan. I'm a medical doctor at Mulago Hospital. Thank you for having me and thank you for joining us.
Yes, sure. Thank you so much, our panelists, for that introduction. Allow us to go deep into the discussion. We are going to start with understanding what exactly diabetes mellitus is, because people don't know what exactly diabetes mellitus is, and you find people describing it in their own ways. And because they describe it in their own ways, of course, it comes up with so many challenges in seeking treatment and everything. So let's start with the introduction of what exactly diabetes mellitus is, and I want to call upon Dr. Kamara to give us the introduction of what diabetes mellitus is.
So let's start by understanding what diabetes is. So diabetes is a medical condition in which your body either does not produce insulin or it cannot effectively use the insulin that it's producing to manage your blood sugar levels. So normally in our body, we have a hormone called insulin that regulates our blood sugar levels. So say after you've had a meal, your blood sugar level starts to rise, and then a hormone is produced called insulin that comes in and helps that blood sugar to be taken up into the cells and the excess to be stored. So when you have diabetes, this hormone is either not being produced or it's being produced, but your body has lost the ability to use it effectively. We say it has developed resistance to the hormone. So that's what diabetes is. So there are different types of diabetes, which Dr. Henry will tell us about. So there's type 1, type 2, gestational diabetes.
Thank you so much, Dr. Kamala, for that detailed description of what exactly diabetes is. At this point, I request us to go deep into the different types of diabetes as she expounded on them. Dr. Sechanzi is going to take us deep on what exactly those types are and what exactly causes them. Dr. Sechanzi, back to you on the types.
Well, as Dr. Kamara rightly put it, basically it depends, everything depends about this insulin, that the types are actually quite many. Up to 5 types, but they are quite, the most common ones are 3 types. That's type 1 diabetes mellitus, type 2, and the gestational. The others, maybe we shall discuss about them another time. So starting with diabetes mellitus type 1, it's the one that happens when the body or the pancreas does not produce enough insulin. And this is the commonest type in the children. So much as we used to think that diabetes is the disease of the elderly people or maybe the disease of the rich, diabetes can actually affect the children. And there's quite a number of young children out there who have diabetes. And for these children, for them, most of the times it's type 1, whereby their pancreas does not produce this hormone insulin.
So, doctor, can we maybe just ask a question? Can we call this type 1 diabetes the disease disease of the young, the diabetes of the young?
Actually, I think we can actually call it that because it's mostly the young children. However, that doesn't mean that adults don't get it. Adults as well can get it. However, most of the times in the young children, it's type 1 diabetes. Then the type 2 is
And I
one
think it's the so-called early onset type of diabetes.
Early onset, because it starts quite early when most of the times people are still young. Then type 2 diabetes, this is the commonest in with the adults, especially people who are a little bit advanced in age and those who have the risk factors, as we shall talk about them later. So in this type 2 diabetes, the insulin is there. The pancreas is producing the insulin in adequate amounts. However, this insulin is not doing its role. So there's sort of ineffectiveness in the way insulin works. Ideally, this insulin acts as a key to help this glucose enter into the cells and so that it can be utilized. However, what happens in type 2 diabetes, you realize that this key is no longer effective, is no longer opening the cells to allow the glucose to enter the cells, and that's what you call insulin resistance type of diabetes. So this type is the commonest in people who are advanced in age, and it's established that over 90% of the population have this type of diabetes. Yes.
Okay, thank you so much, Dr. Henry. I request, if possible, you take us through just briefly what gestation diabetes is.
So whenever I hear the word gestation, it means pregnancy. So this is the a type of diabetes that happens for the first time when people are pregnant. There are quite a number of other medical conditions that will come in pregnancy. There are things like gestation hypertension. Gestation diabetes is also one of them. So someone can actually be normal and they're having their glucose levels well controlled, but when they get pregnant, they get to see their blood sugar levels rising, and we call this gestational diabetes.
Okay, thank you so much, Doctor, for that detailed description of the types of diabetes. Maybe I request to inquire from you. So is it important to know which exact type of diabetes I have? Is it very important? Does it change the management a bit, or it's not important?
Yeah, that's a very wonderful question, Dr. Alex. So realize that depending on the type of diabetes that a person has, the treatment also follows the type of diabetes. So for instance, if somebody has type 1 diabetes where the body does not have enough insulin, for them, the medication would actually be to give them insulin.
To give them insulin that they don't produce.
Yes. Then for type 2 diabetes, the treatment actually also varies. So it's quite important for us to know which type of diabetes someone has so that we tailor our treatment to that.
Thank you so much, Dr. Henry, for that detailed description of the types of diabetes. As he has said, type 1 diabetes is what we call early onset diabetes that starts in the children, or that its point of initiation is childhood. And then the type 2 diabetes is the diabetes that starts in adults, most especially when the insulin is being produced, but it's not being used.
Yes. However, that doesn't mean that doesn't mean that adults cannot have type 1 diabetes. Okay, they can have it, but the proportions.
So you can have these types like cross-cutting different age groups. Okay, thank you so much, Doctor, for that clarification. I request to go to the signs and symptoms of diabetes. What makes me think that maybe I have diabetes, depending on these symptoms that I'm having? What tells me to think that maybe this could be diabetes? I'll begin with Dr. Henry.
Yes, thank you very much. So the signs and symptoms are going to arise simply because someone has a very, very high blood sugar levels. And mainly, one of the things that usually come first will be increased thirst. These patients tend to drink a lot, and as well they tend to urinate a lot. Of course, there are some other symptoms that will happen like weight loss, as well as patients feeling fatigue, but most of the times it's that increased thirst, increased urination. Sometimes they can actually be increased appetite, so they tend to have what you call polyphagia. So these terms, they have other medical terms to mean them. So the increased thirst resulting into increased urination, we can say someone is having polydipsia because of too much thirst all the time, and then from that
they want to drink all the time.
So they tend to drink most of the time, and then they tend to urinate a lot, which is called polyuria.
Is it because they are drinking a lot, or there's something that is causing extensive
drinking urination? A lot partly contributes, but most importantly, the fact that they have a lot of sugar further complicates this polyuria, and the patient tend to urinate a lot. But of course, there are some other symptoms that may not be very specific, things like the fatigue and the weight loss. They may not
that feeling of tiredness all the time.
Yes, it's quite common. And most of the times, they may not even have any symptoms actually, because diabetes is it's quite a silent killer. They usually don't have overt symptoms that show. And also you've noticed that most of the times in our communities, patients come in with complications when the diabetes has advanced and they are having complications.
Actually, some statistics show that almost half of the people who have diabetes don't even know they have it yet. So in the beginning, it's actually asymptomatic. There are no symptoms. So when the disease is still starting and progressing in your body, you won't have symptoms. It's only when it's reached a level where your body can absolutely no longer regulate your blood sugar levels, and then you start to develop the symptoms. So most people here discover they are diabetic when they've been admitted in the hospital with very, very sick with complications. There's someone I know who was the first time she realized she was diabetic, she had come to the hospital with extreme fatigue. She had been exhausted, feeling exhausted all the time, urinating a lot and drinking a lot of water, and thought maybe she had malaria. She kept treating malaria, and then she ended up in the hospital and discovered she was diabetic. So I had to, I always tell people, a good rule of thumb is if you're going to the bathroom in the middle of the night, if you're going to the bathroom more than twice, that's not normal. You should get yourself checked out. Yes.
And sometimes the frequency, because yes, of course, sometimes peeing once in the night could be okay, but you realize that usually when you're having this diabetes, the number of frequencies increases. You tend to go there more frequently. Yeah, the beauty with during the day, usually most people don't notice that actually they're having this problem, but usually night time is the best time to tell, because you rest and you can always monitor. So if you see that you're actually increasing more the frequency at which you urinate at night, it will be important that you have a test at least for diabetes.
At that point, allow me to pause a little bit, and I first pose a question because you talked about the fact that people usually are diagnosed when it is very late. So, and ideally, one of the things that we always look up to is how best can we diagnose people at early stages so that we begin management early. So how frequently should I probably go for a checkup to find out whether I have diabetes or not, so that I prevent being diagnosed when it is very late, like the friend that you've talked about?
Yes, so there's something called pre-diabetes, actually. So this is a stage where your body has started to, it's failing to regulate your blood glucose levels properly. The hormone is already a bit faulty, working faulty, but you're not yet at the stage of being called diabetic. So when you go to the hospital, there are some tests they can do that show that something is already going wrong, but you're not yet diabetic. So that's what they call the pre-diabetes stage. So it's advisable to go for screening to see if you're diabetic, especially if you have a first-degree relative who has diabetes, if you're over the age of 45, or if you have the risk factors for diabetes. We shall look into which we shall look into
the next sessions.
Yes. So it's screening is very important. Like I said, there are so many people that are heading towards outright diabetes and they don't know it. There are some people already diabetic and they don't know it. So screening is advised, especially if you're over the age of 45 and you have a relative who has diabetes.
Okay. Thank you so much, Doctor, for that detailed description. We are going to go for a short commercial break, and when we come back, we shall delve deep into the complications that she has talked about. However, I request to remind you that this show is proudly sponsored by the Ministry of Health of the Government of Uganda and Kamaline Men's Collection that bring you suits for all parties and weddings. Thank you so much.
This message is from the Ministry of Health with support from partners.
Since 2015, Quiz Mali Production has been at the forefront of media innovation. Our passion for storytelling and creativity has driven us to deliver over 100 successful projects, making a lasting impact on the industry. With 4 highly acclaimed TV shows, we've become a household name, bringing quality content to your screens. At Quiz Mali Production, we specialize in content creation, digital media marketing, media buying, and documentaries. We plan corporate events, provide top-notch photography and videography services, and offer seamless translations and live streams for your every need. Join the hundreds of satisfied clients who trust us to bring their visions to life. Quiz Mali Production, your partner in media excellence. Visit us at Quiz Mali and let's create something amazing together.